Hello, and thank you for joining us. My name is Steve Kelso. I'm the Communications Manager at the Kent County Health Department. In less than a year, the world has become a very different place. COVID-19 has evolved from an isolated illness into a global pandemic. Worldwide, more than 500,000 people have died, including 6,000 Michiganders. Hospital systems here in the United States and across the planet have been pushed to the brink. Entire nations have ground to a halt, dragging with them the world economy. Now, as we wait for the good news that a COVID-19 vaccine would surely bring, public health officials are facing new threats from old diseases. The Centers for Disease Control and Prevention recently reported that vaccination rates for children under the age of 18 have fallen more than 20% during the pandemic. Here in Kent County, vaccination rates are also falling. Joining me now is Mary Wisinski. Mary is the Immunization Supervisor for the Kent County Health Department. Mary, thanks for joining me today.
Thank you for having me, Steve. Now is a great time to talk about our immunization rates because August is National Immunization Awareness Month. That means vaccines are important and essential for everyone at all spans and all ages. I wish I had good news. One of the impacts of COVID has been that our vaccine rates have dropped dramatically. Some say in Michigan, even for kids under 2, 50% were not up to date. While our rates in Kent County are better, they still have dropped between 4 and 5%. We have anywhere from 3,000 to 5,000 kids between the ages of 19 months and 3 years who are not up to date. Our teens have never had a great rate to start with, but for our 13 to 17-year-olds, about 54% are up to date. That still leaves a great number, almost 25,000, who are behind on vaccines. Why does that matter? It matters because we need a certain level of immunity in our community in order for vaccine-preventable diseases not to make a comeback. We could see measles, we could see pertussis increasing. So unless we start increasing our rates, public health officials fear that this fall could bring an increase, as you said, from diseases that we have worked very hard to overcome.
Do you have any sense of why this is happening? You talk to parents who are not getting their kids vaccinated. Does it have something to do with the pandemic? Maybe they don't want to come in, maybe they feel unsafe?
Yeah, I do think there's a lot of reasons, and I think the pandemic is a big one. When it was started in March, many doctors' offices closed or had limited hours. And so the availability for parents to bring their kids in just wasn't there. And then as they opened up gradually, parents had many questions. Is it safe? Unfortunately, the news of the COVID vaccine and the warp speed words maybe scared people away from safe, effective vaccines. And I just want to mention that I believe warp speed means how fast we're throwing money at this terrible disease in order to make a vaccine. Vaccine safety will not be compromised. So the message is, please, doctors' offices are open. Everyone is doing extra special precautions in light of COVID. We have mask requirements, limiting only essential people at the appointment, screening and temperature checks on entry, extra deep cleaning. Our staff are wearing appropriate personal protective equipment. Many doctors' offices are separating sick from well child visits. So I think it was a lot of reasons why our vaccine rates plummeted so dramatically this past spring.
Where can people go? If they want to come in here and get vaccines, certainly we're available. We can help you out. How do I find out more information?
You can find out a lot more information, but I do want to make sure that you know that our health department clinics, 2 of which are currently open, the Fuller and the South location on Kalamazoo, we participate in the Vaccines for Children program. And we've also seen an alarming drop in Medicaid kids, their coverage rates. With this pandemic, many people may have lost their jobs, lost their insurance coverage. They may not be aware of the Vaccines for Children program, but it offers free vaccine for kids from birth through age 18 who have Medicaid, who have no insurance, who have insurance that doesn't cover shots, who may be American Indian or Alaskan Native. They get free vaccine. So they can call our scheduling line at 632-7200 for an appointment. They can also call their physician. There are approximately 90 doctor offices in Kent County who also have this free VFC vaccine. So appointments are available, vaccines are available. We can do our part to bring those rates back up so we don't see measles and pertussis happening this fall.
You know, let me ask you something. In recent years, we've seen a certain level of vaccine hesitancy anyway. How is that going to play? If this continues, how is that going to play when there is a COVID-19 vaccine and you have now the responsibility of administering that vaccine? Do you think there's going to be this overall sense among people out there? The people are going to remain hesitant even to get that vaccine, aren't they?
I totally agree with you. I think we have a big job to do to educate people, to show them the science. Because again, as I mentioned, warp speed in people's minds means the vaccine won't be safe. But they don't understand that vaccines go through phase 4 trials. The current phase 3 trial is 30 to 40,000 people. The phase 4 trial will be even more people. They will make sure this vaccine is safe and effective, or they will not release it. And I think some people may wait until they see what other people do, until they get reports. I can tell you that I have true trust and faith in our science and in our leaders, and I would not hesitate once it comes out to get that COVID-19 vaccine. So that's the message we have to do, to educate people so that we can allay their fears, and also we can do away with some of those myths that are out there.
All right, very good. Mary Wisinski, Immunization Supervisor here at the Kent County Health Department. Down below this video, we'll put links to how you can find out more information and the number you can call to make your appointment. Thanks for joining us. Hope to see you again real soon.